Hello, I am Dr. Oliver Brooks, President of the National Medical Association and Chief Medical Officer at Watts Healthcare Corporation in South Los Angeles. And I welcome you to the fourth in a series of live stream broadcasts, NMA Talks. Today, our subject is police use of excessive force and open dialogue. Our three prior live streams were on COVID-19 and update, COVID-19 maternal and child health implications, and COVID-19 mental health. We have found the need to pivot. We've had to pivot to police brutality because this is the issue that we as the Black community presently face. I have a group of excellent panelists, and we will get to them in a moment. On May 25th, 2020, George Floyd, a 46-year-old African-American male, was taken into police custody by Minneapolis police after being suspected of using a $20 counterfeit bill to make a purchase. He was handcuffed, and at some point, one of the police officers pinned him down with his knee on his posterior neck. Mr. Floyd struggled to breathe, stating such audibly. After 8 minutes and 46 seconds of continued neck compression, Mr. Floyd became silent. Paramedics were called, who found Mr. Floyd unresponsive and pulseless. He was later declared dead at a local hospital. The National Medical Association, the NMA, extends its deepest condolences to the family and friends of Mr. Floyd. The killing of George Floyd is another reminder of the lingering effects of institutional racism in many communities throughout these United States. The conduct of these police officers is reprehensible and requires a full criminal and administrative investigation. Studies have shown that Black people are 3 times more likely to be killed by police in the United States than white people. More unarmed Black people are killed by police than unarmed white people last year, despite the fact that Black people comprise only 14% of the population. The NMA considers this a public health crisis. The NMA is the largest and oldest national organization representing African-American physicians and their patients in the United States. The NMA has long asserted police excessive use of force as a public health issue, as stated, and has published both a position statement on police excessive use of force and a position paper on urban violence in minority communities. The organization is committed to addressing issues of social determinants of health, structural violence, and systemic racism that fosters an environment that leads to the disproportionate policing of communities of color. I would now like to introduce our 3 distinguished panelists. First, Dr. Joy M. Carter. She is the forensic pathologist in San Luis Obispo County, California. She is board certified in anatomical, clinical, and forensic pathology, and she's the nation's first Black chief medical officer. Dr. Eva Frazier. She is a board certified internist in Missouri and the vice chair of the NMA's Task Force on Gun Violence. And Dr. Roger Mitchell. He is board certified in anatomic and forensic pathology, and he serves as the chief medical examiner of our nation's capital, Washington, D.C. I will ask a few questions of the panelists, and then we will open the floor for questions to be submitted by those in attendance on this webinar. My first question goes to Dr. Mitchell. Dr. Mitchell, you are chair of the NMA Task Force on Gun Violence and the DC Chief Medical Examiner. Can you talk to us about the death of George Floyd? Why is there so much unrest?
Well, I mean, we know, thank you, President Brooks. We know why there's unrest. I mean, the whole nation and the whole world watched Mr. Floyd get murdered in front of our eyes. We watched the compression of his neck to death. We watched it. And so I think it's important for us to understand that that's what we all saw. And what we saw is what ultimately the medical examiner and even the independent physicians found, that indeed his death was a result of the actions of those law enforcement officers. As the co-chair of the NMA task force on gun violence, we think it's important to elevate this conversation because our Black lives, they matter. The reality of it is that the death of George Floyd is a symptom of institutional racism. It is a direct correlate to how communities like ours have been disenfranchised. And it's important for us to elevate the conversation and talk about the solutions. But it's clear why there's unrest. If there is no justice, then I don't know how the community can rest.
No justice, no peace. Dr. Carter, you were the first African-American chief medical examiner in the United States. Can you frame this issue of excessive use of police force for us?
Certainly. We're tired of being tired. This is one in many, many cases where Black people have died while in custody. And there have been questions over decades. This is one of the first cases where you have complete documentation. There are many takedown procedures that law enforcement can use, but having a sustained knee on the neck with documented 8 minutes plus is beyond irreversible injury. We've had many cases that have made the media, but they didn't have this type of documentation. Questions going back across this country of people dying unexpectedly or suddenly in police custody.
And you said documented, you mean video?
I mean video.
Yes, this is the age of video. Okay, Dr. Frazier, you are vice chair of our NMA commission on task force on gun violence. How did you have come to this work, and what have you done to help the medical and general community understand the problem of police excessive force?
Thank you, Dr. Brooks. I think being from St. Louis, my involvement primarily began with the Michael Brown killing and protests. I participated initially in protests there. After that, I began educating myself, going online, searching for articles on deaths in custody. And I have to say, it was like going down a very dark rabbit hole. I imagine that, like most other people and most general physicians in practice, no one really realized the breadth and depth of this problem. I'm sure Dr. Mitchell and Dr. Carter, as forensic pathologists, were well aware, and I know Dr. Mitchell has been working on this since his days in medical school, but it was an eye-opener for me. Then following Freddie Gray's death in custody, it really occurred to me, in listening to the police reports that stated that this was something that happened and not securing him in the van, that he was actually injured during the takedown. Any physician looking at those videos could see that he was already experiencing weakness in his legs, which indicated some type of cervical spine injury. And equally obvious to me was that there was a great need for a voice that could speak to the medical and physical truths about these deaths and killings. So subsequent to that, the St. Louis chapter of the NMA and I drafted a resolution on lethal and sublethal injury resulting from law enforcement altercations, which was then approved by the NMA House of Delegates and publicly released on August 15th, 2015. At that same convention, Dr. Mitchell and I were appointed by Dr. Edith Mitchell, no relation, NMA president at the time, to the Task Force on Violence as a Public Health Issue. In fulfilling our mandate to educate physicians and community leaders on the subject, the NMA held a number of panel presentations, on violence in the African American community that were presented at NMA conventions and colloquiums. And also we presented the topic to the Congressional Black Caucus during their annual conferences. And that is to address the real need for change. It's going to have to be policy driven. And so having our legislative leaders involved is critical. Following that, I co-authored with Dr. Roger Mitchell the NMA position paper on violence and the epidemic and its epidemic proportions in the African American community, which gives an overview of the many forms of violence in the community and the many effects that it has on the African American community in particular.
So you stated a resolution that was 2015, and here you are in 2020. And obviously the history goes back much farther than just 2015, but it is good to see the NMA has been active. Dr. Mitchell, and this is a question that I feel kind of strongly. We're in the midst of a COVID-19 pandemic, which has affected the African American community disproportionately. What is your perspective on this and how it may or may not have impacted the community response to the killing of George Floyd?
Well, like you said, we're in the midst of a COVID pandemic. We're still nationwide having about 1,000 deaths a day, and it's primarily our community, right? African American community, Latinx community, and individuals that have pre-existing conditions like obesity and hypertension and diabetes. And so, you know, the COVID-19 infection, it affects those individuals that are primarily those that don't have as much access to care. We find us in the African American community with that happening with us. The death of George Floyd is, quite frankly, no different. In the sense that it primarily affects African Americans, African American men, police use of excessive force, and it leads to our death disproportionately. We make up 13% of the population, but make up 24% of all deaths in custody. And so it's important to make that connection. And frankly, we have to applaud those young people and people in general that are going out to protest, because they're not only risking their lives as it relates to the militarization of our police departments and the dispersion of canisters and the beating of their bodies in the streets during these protests, but they're also risking their lives as it relates to the COVID-19 infection, the possibility of contracting that disease and then bringing it home to loved ones. So, but I am glad that it's not deterring them. It's not deterring us to going out into the streets and having this conversation and lifting our voice, because you can see the streets are filled with people that are fed up with the status quo and the institutional and structural racism that leads to the death of Black and brown bodies.
So we have an acute pandemic overlaid on a chronic pandemic. And like who said, one of you are tired of being tired? That is where we are. I would like to remind the audience that we will be taking questions from viewers, and you can begin to place questions in the comments or chat area. So please do so. We want to hear from you. Dr. Carter, why is police use of force a public health issue? And then I'll even ask the more difficult question, what are some of the solutions? And I will likely ask all of the panelists. But a public health issue.
It's a public health issue with abusive treatment from police officers, because this is killing particularly Black men and Black women to excess of our ratio of population. We as people of color have been under stress since slavery, and that stress has not let up since slavery supposedly ended. So you already have physical stress. You have set up a socioeconomic ladder that you often can't climb of institutional racism. You're underemployed, you're out there, and you are sometimes a magnet for law enforcement who may harbor stereotypical ill will against Black males. And so the numbers show that this is a predictable higher rate of deaths of Black men and women, and that makes it a public health issue on top of our already chronic health issues that we have, as well as a lot of stress. And that makes it a public health issue. And as far as solutions, we have to come to a point where we have respect of all human beings. We as pathologists know life ends for everybody. Nobody gets out of life without dying. But we have a very unhealthy disrespect of different people in this country. And until we realize people are people, that we have the same DNA, that we come from the same roots, we might have come from different branches, but the roots are there and established scientifically. Until we accept the fact that we are all people, that we're all in this together, we're going to have this chaos on our hands.
We're all till Black Lives Matter. Is that what you're telling me? Yes.
Black lives certainly matter.
Thank you. Dr. Frazier, you had referenced some of the actions that the NMA has taken in terms of your resolution. Can you talk about the NMA police use of force statement that was published several years ago and what some of the tenets of that may be?
Yes. The NMA police use of force statement specifically addresses police tactics that put unarmed suspects at unnecessary risk for injury and death. It calls for an end to the use of chokehold, or placing the knees or body weight on a person's chest, neck, or head, all of which actually would increase the likelihood of resistance and struggle from someone being put in those positions, very similar to what would happen to someone drowning. They cannot not struggle when they're being essentially suffocated. That law enforcement recognize the presumption of innocence until proven guilty, and that they fulfill their duty to make safe arrests. We also call for training for law enforcement officers in appropriate and non-lethal methods of restraint, and the establishment of uniform practice in reporting cause and manner of deaths in custody by way of the U.S. Standard Death Certificate, and the establishment of a national surveillance system to capture injuries and morbidities secondary to law enforcement interactions. We can't understand a problem without being able to study it. I would add to that, though not in that statement, we've recently come out and addressed another very important component of this, and that is that any law enforcement officer witnessing unnecessary and excessive use of force should report it, and if not, they should be considered complicit.
So concrete actions to address this issue. Thank you. I'm going to ask this question. It can go to either of my two pathologists, medical examiners. I'm going to shoot it to Dr. Carter. There have been questions in the media about the cause of death, and we've kind of addressed that. But I had a concern initially when they were talking about his underlying conditions. So can we be very clear on the cause of death? And just let's wrap this up and close this off once and for all.
Well, there are two different causes of death out. The cause of death is from the asphyxia, and that is from lack of oxygen through the brain. You get to an irreversible level if you do not have oxygen going to your brain. 8 minutes and 46 seconds is way past a point of irreversible change. It is customary across the country to add if there are underlying conditions that contribute to a person's death, but there is a main cause of death. And in this case, that would be asphyxia. Different death certificates, there's no uniform federal death certificate. They're different by state. And in the one case, you have the formal certificate from Minnesota lists underlying conditions as part of the primary cause of death. And then the second case, there is a separation of just the primary cause of death from what I understand. It would be the pathologist who testifies as to that cause of death to break that down into what those underlying causes would contribute and separate the primary cause of death, as we all saw was the sustained knee to the neck, preventing blood flowing in and out of the central nervous system.
Thank you.
Mechanical asphyxia is the term. Mechanical asphyxia.
Okay. I have a question here. Usual suspects are already being rounded up in the George Floyd trial and officers' defense. Drugs in the system, presumed resisting arrest, now COVID-19. So how does the NMA and its constituent member counter this type of systemic playbook? Thank you to the police and their superiors. And so I'll rephrase the question. I'm going to send this to you, Dr. Mitchell. How do we respond to the fact that, oh, the guy was using drugs, oh, the guy was committing a crime? How can we be clear to the public that whatever happened, whatever was going on in that man's life and in his body, what happened was clear murder?
Yeah, so I appreciate the question. I think it came from one of our viewers, and the reality of it is that this is asphyxia due to neck compression or mechanical asphyxia, however you want to the term. But regardless of whether or not there was underlying conditions, but for the actions of that law enforcement officer, George Floyd would be alive today. And so that's clear, and it needs to be clear and it needs to be communicated. I think what is NMA doing? Well, NMA is holding something like this on a national platform. And if you don't know, Dr. Carter and I are both government employees. We're both individuals that really, in the medical examiner community, this is frowned upon, to come out and to have conversations about other people's findings, about the cause and manner of death on national cases where you didn't see all of the findings yourself. We're taught not to comment, but both of us have felt like it's important for us to come out as experts to say that George Floyd was killed under the knee of that law enforcement officer while 3 other officers watched him die, as well as the rest of the world. And we say it emphatically, and we say it without reservation, and we say it, quite frankly, at risk of our own professional careers because we work for government. And so it's important for NMA. We've put the statements out that Dr. Frazier described. Dr. Brooks has been on this podium as well, speaking about it. We've put out additional statements. We will continue to educate, and we will continue to communicate and make ourselves available so that justice can be served. So, National Medical Association, as described, is the oldest and largest group of Black physicians in the country. If we were ever to be loud and heard, it is now. And so we will continue to speak truth to power. Actually, Alicia Wilson, who is one of the forensic pathologists who was part of the independent autopsy, is a NMA member. She's a member of the pathology section. And so from the beginning, the National Medical Association is in the fight for justice and health and safety of our people.
Thank you.
And if I can just add two phrases. We say in forensic pathology, you take your victim as you find them. Everybody found this victim, documented on video, with a prolonged knee to the neck. We also say the autopsy begins at the scene. Well, we have documentation of 8 minutes and 46 seconds of this scene.
Thank you. I have a question for you, Dr. Frazier. So we have protests ongoing as we speak. If I gave you a microphone and a podium and put you out in front of the protests in downtown St. Louis and said, "You have 2 minutes," what would you say to those protesters?
I would first thank them for their support and for coming out and putting themselves at risk during an epidemic because this cause is so important. I would ask them to remain vigilant and to remain engaged because we have seen this come to the forefront. We have seen people protest before, and we've seen it fade away and other things take precedence in the media. And if we do not address this, it will continue to recur. So I would ask them to remain engaged and to do what I did. I mean, I came to this not knowing what to do. I began a research process of my own, and I started finding different avenues to become engaged. I started working with local officials. I started working with national organizations. I started going to conferences. It's critically important that we address this at state and local levels. And so that means learning about your elected officials, knowing who your DA is, knowing who your mayor is, knowing who your county executive is, and voting every opportunity against people who do not value all lives and Black lives in particular.
Well stated. Thank you. Questions for you, Dr. Mitchell. What can we as citizens do to hold police accountable for their actions?
Well, I think that you have to get involved. You have to get involved. General citizens is no you if your local jurisdiction doesn't have a citizen review board for law enforcement, then you want to make sure that that's the case. If your jurisdiction is not wearing body worn camera, then you want to make sure that is the case. If your jurisdiction is not following the 30 guidelines that's put out by the Police Executive Research Forum surrounding use of force that really lays out how law enforcement needs to be engaged, then you want to ensure there needs to be citizen oversight to law enforcement. If your law enforcement does not live in the community that they serve, they need to start living in the community that they serve. If they don't look like the community that they serve, then there needs to be programs from the high schools or the local colleges that engage those individuals that are in and from the community to police within the community. And when you see something that is counter to this progress that we're making, it is up to you as a general citizen to call that out, even if you're not the direct victim of the law enforcement force or the law enforcement way of treating someone improperly. So there's so many different ways, but the big thing is to get involved.
Thank you. So I have a question from an attendee, and I'll give this to you, Dr. Carter. What can other medical organizations do, actionable items to help our community members and community to start to mend and bridge the racial gap and divide? And so I would say not just other organizations, but what can people do? Just like the last question, to hold police accountable, what can people do to bridge the racial gap and divide?
The one thing that other people can do is to, one, look inward, look at yourself, and understand what has been happening to people of color. What I'm seeing in a lot of the protesters, there are people of different backgrounds and ethnicities joining together because this is right in your face. You can see this. And the other actions that we saw in the last couple of weeks, this is right here. And people are waking up and saying, hey, I didn't realize what was really going on. And so we need people to come together and to understand where stereotypes have been used. Yes, even in the medical profession, but to also hold their local police accountable and their other local elected officials, that they're treating all people like people. I can't express enough that we need to make sure that our local officials are respectful of everyone in the community, from the school board to your local election board, and holding people accountable. And sometimes, we forget. We forget sometimes even you're taught in medicine and other areas that, everyone on sickle cell seeking drugs versus these are people that are in pain. So we have to look at some of these insensitivities that have been going on for far too long and understand DNA relates us better than anything else.
Can I add to that, Dr. Brooks and Dr. Carter? The AAMC, which is the Association for Medical Colleges, partnered with the National Medical Association some years ago to talk about Black men in medicine and initiatives to bring more Black men in medicine. We know that there were more Black men in medicine in the 1930s than there are now. And so when we talk about medical organizations, we're really talking about medical schools. And if we can talk about ensuring that there's opportunities for Black men and women, Latinx men and women to get into the medical careers so that we can have culturally competent care and more Black physicians and minority physicians to engage in policy decisions and policy discussions, treatment of patients. All of that bridges racial divides and racial gaps. When you're going to school with someone that doesn't look like you, then you're going to be more inclined to understand and treat your patients a little bit differently. I know that's a little bit of a different spin on the question, but it's important that these organizations, I was just on a video chat earlier today with the American Medical Association, and they have new diversity and equity chair, Letha Maybank, who's an NMA member. All of these medical organizations must have a diversity portfolio and have initiatives that are effectively going to be going after the issues of disparities and equity in our community.
Yeah, thank you. Thank you. So it's interesting because the answers to preventing the disparities we see in COVID-19 deaths also relate to the same issues with excessive use of force. I have a question from the audience, but I want to ask a question first of Dr. Frazier. How do you address in the context of a racist America this racism? What can we do? I mean, it's pervasive, and if it's there like that, I mean, people are going to just say, well, it's just a bad apple cop. The cops, 99% of the cops are good. It's just 1% of them that are bad. So we just have to weed them out. Versus this is a pervasive issue in the police force.
So are you asking in terms of the police or the public in general, or?
Perception that is being often raised that it's just a few bad apples and it's not really a broader issue. It's just if we could just surgically remove that 1 out of every 100 bad police, it'd be fine.
I think for me, the biggest clarity on that issue is the lack of accountability. If we were to say that we were committed to making change, we would see officers who essentially murder unarmed civilians in jail. And that's a rare occurrence. So I don't think we can say it's just a few bad apples. There's something systemic about it if you have an agency that essentially condones and allows these murders to go unpunished. So I don't think there's any argument about that. In terms of what can we do about it, racism is systemic. And I think the first step in that process is recognizing that and understanding the nature of it, the reasons for it, the history of it. There's a great deal of revisionist history, which essentially changes how we look at people, how we look at different groups and make them the other. And we have to accept and meet that face on and not deny it, not hide it. And it has to go from all of our institutions, educational institutions, not just law enforcement institutions. It has to do with our politics. It has a lot to do with who we allow and elect to represent us. So I think, first we have to start with electing political leaders who recognize the problem and are committed to investing in change.
Okay, thank you. And that's a fruitful answer. So we have a question from Kevin Jefferson, an NMA member. How do we, the public, prevent George Floyd from being put on trial? And more broadly, how do we keep the focus on the real issue as opposed to what the distraction is about the violence and the protesters and Antifa and law and order? The focus needs to be on the issue and not the response to the issue. So I'm going to give that one to you, Joy, Dr. Carter.
Okay. I think we also have to be vigilant as our Black organizations to make sure that we keep the facts up front. Persecuting somebody after they've died or bringing up a past wrong where they've served time is character assassination. This man has already been assassinated. And we have to keep the facts up front. Because when we have other criminal behaviors that have taken place with mass shootings, we get into the psychology of what happened and their poor childhood. When we have Black people that are killed under questionable circumstances, we start getting into their background as if they deserve to be killed in this way versus someone who served time for something that they did. So I think our organizations need to be upfront, keep the facts up there, talk about the man as he was, put that out there into the media, and hold these other groups accountable for this post-mortem character assassination.
Thank you. So we have just a few minutes left. I want to pose one question and allow each panelist to give me about 2 minutes in terms of their response. If there were one or two things that you could make happen in terms of action to do your best to not have this pervasive issue in the Black community of excessive use of force, what would they be? And I'm going to start with you, Dr. Mitchell.
The rest of them, they get some time to think. So I'll try to use my 2 minutes wisely so they can be better prepared to save the world. It's a hard one, Dr. Brooks, because we're talking about 400 to 600 years of oppression of a people, where the death in police custody is a symptom of a larger disparate system. And that system, we talked about things like accountability. But if I'm going to be pragmatic and I'm going to speak directly to this, and I don't have a magic wand and it's something that we can actually achieve, then I'm going to improve the screening and selection process of our law enforcement. Our law enforcement officers must be coming into the line of policing, or some of them must be coming into the line of policing to inflict harm on people that are different than themselves. That has to be a motivation for some of these law enforcement officers. I don't think that once they get a blue uniform, it changes them that much to want to kill and injure Black people. I think that the ones that engage in that behavior are coming in the door having some type of bias, some type of fear of the Black man, Black woman, some type of indoctrination that occurred beforehand. I know enough police officers and FBI agents and alike that I eat with and share with and love and in my family and so on, to know that, to the point that it is not everyone, but the system that enforces law is a system that has to be changed. So first, just a better process. All of them need to have at least undergraduate to master degrees to make those type of decisions on the fly, and need to be having to have mental health checks on a monthly basis to ensure that there's no decompensation. Continuing education that ensures that they're meeting standards, like physicians that have to save lives on a regular basis. They get the opportunity to change lives in their day-to-day. And then the other piece is to realize that law enforcement is just the tip of the spear. It's just the tip of the spear. So you have a long spear, and you have something else holding on to it, which is the racist, classist policies of American capitalism that forces individuals to be other and to be poor and to be disenfranchised in order for the corporation to exist the way it exists. And so we really need a reformation, a reconstruction of the values of the American people and the American future. And so I know that, one is pragmatic, the other, is hopeful. And I think if I had those two, then it would be there.
Okay, thank you. And I called on you first because I knew you'd be ready. I will present the question next to Dr. Frazier. One or two things that you could have as actionable items if you had the power, and it can be fanciful, pragmatic, however you see it.
Well, I think it's critically important that that in the police force and in leadership in particular, that there's representation amongst African Americans on the force. I think if you're going to have and develop a real empathy with the community that you serve, you need to be represented by people in the community. So I think, first of all, and particularly in positions of leadership. And then secondly, I would say integrity in leadership and accountability. And I think what we're missing here is accountability, that people are essentially held to the same standard that we expect others to be held to. So I don't think being a police officer, carrying a badge and a gun should be equivalent to getting a pass when you commit a crime.
Thank you. Now, I pose that finally to you, Dr. Carter, one or two things that you would see change or put in place.
Okay. Well, I've been a forensic pathologist for over 30 years, and even in training, deaths in custody are always significant questions and problems. One, we need more minority forensic pathologists so that we can trust and have faith in the doctor in our community. That's one of our issues because of what's happened to us historically. Two, I believe in community policing. We need police officers back in the community, walking a beat, getting to know the people instead of just seeing them as the enemy, see them as part of the community, and the community see the police officer as helping them. Get back to the protect and serve, not abuse, beat, and kill. I think we could, and I agree with Dr. Mitchell, have a better screening process for police officers, and also the community holding them accountable. We as community members need to be voting. Dr. Mitchell mentioned earlier, we need to get on these police review boards. We need to be proactive in our community. We also need to train up our children correctly. And we need to have our phones on all the time so that we have documentation of what's happening to us. We have to move forward in unity because this is happening all over the country. This is one case that was caught on video phone. It's not all the cases. And so instead of hearing about it, we need to be proactive. We need to know who is involved, who's in charge of our community, and make our wishes, our desires, and our accountability known to them.
Thank you. Thank you very much.
And Dr. Brooks, can I just say one other thing? If we're having pie in the sky wishes on this subject, and thinking about it, I think we'd all like to really get at the root causes of crime and really address poverty issues and other inequities that essentially cause us to need police and address those issues so that maybe we can get to a place where we don't need such a large police force to patrol our communities.
The ever-present social determinants of health.
Absolutely.
And wellness. So I would like to thank each of our panelists, Dr. Roger Mitchell, Dr. Eva Frazier, and Dr. Joy Carter, for being our panelists today on police use of excessive force and open dialogue. It was surely an open dialogue. I'd also like to thank our producer, Dr. Michael Knight, for putting the structure to this forum. I'm Dr. Oliver Brooks, and I thank you all for being in attendance at our 4th NMA talks. So keep your eye open. We should have more. So with that, I will close out this forum. Thank you, everyone, very much.
Thank you.
Thank you.
Gotta find